Hi friends, welcome back to Complete Medical Coding, a complete CPC learning channel. Today let's discuss few more mock questions from the CPC examinations. Okay, so friends, if you are new to the channel, please subscribe and support me. So let's move to the questions one by one. So let's look into the first question. A 52-year-old patient is admitted to the hospital for chronic cholecystitis, for which a laparoscopic cholecystectomy will be performed. So here in the first sentence itself, it's mentioned the diagnosis, right? Patient is admitted to the hospital for chronic cholecystitis, which is a confirmed diagnosis. And what's the procedure that is going to be performed? Laparoscopic cholecystectomy. A transverse infra-umbilical incision was made sharply, dissecting to the subcutaneous tissue down to the fascia using access under direct vision with a vesiport, and a scope was placed into the abdomen. Now it is mentioning how the procedure is being performed. Okay. 3 other ports were inserted under direct vision. The fundus of the gallbladder was grasped through the lateral port, where multiple adhesions to the gallbladder were taken down sharply and bluntly. The gallbladder appeared chronically inflamed. Dissection was carried out to the right of this, identifying a small cystic duct and artery. Was clipped twice proximally, once distally, and transected. The gallbladder was then taken down from the bed using electrocautery, delivering it into an endo bag and removing it from the abdominal cavity with the umbilical port. So all these are the description of how the procedure is being done. Okay. What CPT and ICD-10 codes should be reported? So we know from the first sentence that the diagnosis is chronic cholecystitis and the procedure is laparoscopic cholecystectomy. So we just need to code only for that. There is nothing else mentioned about the diagnosis or change in diagnosis or change in procedure. Nothing is mentioned in the question after that. It just described the procedure, how the procedure is being done. So this way, if you see the question, it looks a big one. It looks complicated, but when you read it, you will come to know, you understand that this is a simple question. Okay. So what we have to code for? We have to code for diagnosis chronic cholecystitis, and then procedure is laparoscopic cholecystectomy. Okay. So let's look into the first diagnosis in option A, K80.18. Always go with diagnosis first, okay, which will make it easy for you. K80.18. Just open your ICD code book and go to K80.18. What is K80.18? Calculus of gallbladder, it's mentioned. Calculus of gallbladder with other cholecystitis without obstruction. Now, let's look into other option. K81.1. What is K81.1? Chronic cholecystitis. Yes, we need that code. Chronic cholecystitis. Still, just check the other two codes also. K80.64. K80.64 represents again calculus of gallbladder, which is not the correct one. K81.9. Cholecystitis unspecified. Here it's clearly mentioned chronic cholecystitis. So we should not use the code K81.9. K81.9 represents cholecystitis unspecified. For example, if in the question it's just mentioned patient is admitted to the hospital for cholecystitis, it means we don't know whether it is acute or chronic. In that case, you have to code K81.9. Okay. But here, since it's clearly mentioned as chronic cholecystitis, we have to code for chronic cholecystitis, which is in option B only. So our answer will be option B. But we didn't check the CPT code. Anyway, that will be the answer, but still you can just confirm the CPT code also. What is 47562? Just take 47562 in CPT code book. That is laparoscopic cholecystectomy. See how easy the answer is to find the answer for this question, right? So within 1 minute or less than a minute you can find the answer. Okay, usually for one question you have to take a maximum of 2 minutes only. Otherwise you will not finish all the 100 questions in 4 hours. So maximum is 2 minutes. So here in this question you can easily find the answer in less than a minute. So this is how you have to check the question, understand the question, and then find the answer. So here the answer will be option B, 47562 and K81.1. So here let's move to the second question. Patient with hemiparesis on the right dominant side due to having a CVA lines at home alone and has a therapist at his home site to evaluate meal preparation. The therapist observes the patient's functional level of performing kitchen management activities within safe limits. The therapist then teaches meal preparation using one-handed techniques along with adaptive equipment to handle different kitchen appliances. The total time spent on this visit was 45 minutes. Report the CPT and ICD-10-CM codes for this encounter. So here the question is related to rehabilitation. Okay, these codes 975 represents all rehabilitation codes. Anyway, let's move to the ICD codes one by one. What is our diagnosis? Hemiparesis on the right dominant side. Okay, so we have to look for the ICD code. Hemiparesis. What is the first code mentioned in option A? I67.89. What is I67.89? Other cerebrovascular disease. Only other cerebrovascular disease is mentioned. We have the exact code here, exact ICD, exact diagnosis, hemiparesis. So let's look into the other codes. Just we will check all I codes first because G code represents just the pain. Now I69, what is the next I code in the options? I69.951. What is I69.951? I69.951 represents hemiplegia and hemiparesis following unspecified cerebrovascular disease affecting right dominant side. Yes, we need that code, right? That is the exact diagnosis. Hemiplegia and hemiparesis affecting the right dominant side. So wherever this code is there, we can look those options only. So except option A, in all other options, this code is mentioned, I69.951, right? So that should be the code. Now, what is G81.91 in option B? G81.91. That represents a pain. But here, anyway, let's open that G code first. G81.91. Just go to G81.91. What does it exactly represents? 81.91 represents G81.91 represents hemiplegia unspecified affecting a right dominant side. This is also hemiplegia. But we have the exact, we already got the exact diagnosis, hemiparesis. This is hemiplegia only. We already got the exact diagnosis as hemiparesis affecting on the right dominant side. So we can skip this G code because both here in this G code there is no hemiparesis mentioned. Okay, so we can skip wherever G code is there. So option B is also skipped. Now in option C, I67.89 again it's present, which was incorrect, other cerebrovascular disease. We already have the exact diagnosis as I69.951. So option C also will not be the answer. So our answer will be automatically will come to know as option D, I69.951. But still look into the CPT code. What is the CPT code? 97535. 97535 represents self-care home management training, example activities of daily living and compensatory training, meal preparation, safety procedures and instructions in use of assistive technology devices, adaptive equipment, direct one-to-one contact each 15 minutes. So here our time was 45 minutes. So each 15 minutes we have to quote 97535. So 45 minutes means times 3. So automatically our answer will be option D. 97535 times 3 and the diagnosis for hemiparesis I69.951. Third question. This is the same that big type of question, but don't skip initially while seeing the big question, because mostly big questions are having easy answers. Okay, so let's move to the third question. Operative report. Diagnosis. See, the diagnosis is clearly mentioned initially. Idiopathic gout, left knee. So we already got the diagnosis, right? Idiopathic gout, left knee. Now procedure also it's mentioned directly. Aspiration, left knee. See, but still if you find these two like the exact diagnosis and procedure in the initial line itself, don't think that okay, no need to read the remaining part. Don't ever think like that. You have to read it fully, because sometimes the procedure might have something else in the explanation. Okay, so you need to read it anyway. Just read one time, you will come to know. So let's read the procedure, how the procedure is being done. Procedure. The knee was prepped and draped in the usual sterile fashion. After the skin was infiltrated with lidocaine, a needle was inserted through the skin into the joint and 10 ml of slightly cloudy yellow fluid was aspirated from the knee. A sterile dressing was applied. There was good apposition and hemostasis. No complications. And the patient tolerated the procedure well. The patient was advised to keep the dressing clean and dry. Instructions were given for signs and symptoms of injection such as increased pain, swelling, redness, pus, heat or fever. Patient was told to return immediately if any of these developed. His bandage was placed. Fluid showed glucose 156, WBC 100. These findings did not seem to indicate septic joint. The patient will be treated with Keflex and Vicodin. She is to ice, rest and elevate the left knee. She is to contact her doctor on Monday and follow up. She is to return for any fever, redness of the left knee. She understands these instructions and agrees to follow up. What CPT and ICD-10 CM codes are reported? See, after reading the question also you understand that this is nothing happened in the procedure. Everything went well. Whatever is the diagnosis and procedure, only that is mentioned. So we need to code for diagnosis idiopathic gout, left knee. What will be the code for idiopathic gout? What is the first option? M10.9. M10.9 represents gout unspecified. Okay, M10.9 represents gout unspecified. No, this is idiopathic gout. It's not an unspecified one. So what is the next one? M10.062. M10.062 represents idiopathic gout, left knee. So this is the exact diagnosis. Which knee is also mentioned in the question. Idiopathic gout, left knee. So our ICD code will be M10.062. So answer will be either option B or D. Let's go to option B, 20610. So what is our procedure? Aspiration of left knee. Okay. 20610. What is CPT code? 20610. 20610 represents arthrocentesis, aspiration or injection of major joint bursa. And what is the CPT code in option D? 20550, which represents 20550, injection single tendon sheath ligament. This is not injection, right? This is arthrodesis. So our CPT code will be 20610, which represents arthrocentesis, aspiration or injection of major joint. Yeah, left knee is, of course, it's a major joint. So aspiration. So we got the answer as option B, CPT code 20610 and ICD M10.062. Okay. Let's move to the fourth question. Two malignant lesions on the scalp measuring 1.1 centimeter and 2 centimeter, and one malignant lesion on the neck measuring 2.2 centimeter were destroyed. Electrocautery was used for the first two lesions and laser was used for the third lesion. What procedure codes are reported? So here, what is the procedure done? Destruction of malignant lesions. Total of 3 malignant lesions. First 2 malignant lesions on the scalp and the third malignant lesion on the neck. Each measurement is also mentioned in the question. And the first 2 malignant lesions, which is on the scalp, was removed using electrocautery. And the third one, which is on the neck, was removed using laser. Okay. So, which means multiple procedure is being done in the question, in the procedure. So, multiple procedure, for reporting a multiple procedure, we should use the modifier 51, which is understood, right? So, let's look into the CPT codes options one by one. Just skip the first option because there is no modifier mentioned. But still, if you want, you can check it because in some description of CPT codes, it is the modifier is already included. So we can check also that one, no issues. Anyway, so the first malignant lesion measurement is 1.1, second one is 2, and the third one is 2.2. So accordingly, we have to code it. Okay. What is the first code? 17276. Open the CPT code book. 17276. What does 17276 represents? See, destruction, malignant lesion, example, laser surgery, electrosurgery, cryosurgery, chemosurgery, surgical keratination, scalp, neck, hands, feet, genitalia. So everything is there included in this description itself, in the description CPT code 17270. But in that code, the diameter is 0.5 centimeter or less. Okay, so 17270, in that it is already mentioned electrocautery procedure, laser surgery, everything is there. And then scalp and neck, everything will come under those under that description, which can be of different CPT codes for the different measurements. So our first one is 1.1 centimeter. 1.1 centimeter will be option 17272, right? 1.1 centimeter lesion diameter, 1.1 to 2 centimeter. So 1.1 to 2 centimeter, we have to use the code 17272. So since it's 2 lesion for the scalp, you have to code it separately, 17272 and 17272. Okay. And what is the third one? On the neck, measuring 2.2 centimeter. 2.2 centimeter will be in 17273. Lesion diameter 2.1 to 3 centimeter. 2.2 centimeter is, it comes in CPT code 17273. Right? So what will be the answer? 17273, 17272 with modifier 51, 2 times. That 1 times 2, because total of 3 lesions are destroyed. So our answer will be option C. 17273, 17272 with modifier 51 and again 17272 with modifier 51. Okay. Let's move to the fifth question. A 45-year-old female has a stricture on the left ureter with ileal conduit at the uretero-ileal anastomosis. She has had this chronic stricture and receives scheduled stent changes on this side. She is here for her regularly scheduled stent change. What CPT and ICD-10-CM codes should be reported? So here the patient is having problem with the left ureter. Here it's not clearly mentioned the exact diagnosis, right? Anyway, let's look into the options, the ICD options one by one. What is N99.89? N99.89, go to the ICD book. N99.89 represents other post-procedural complications and disorders of genitourinary system. No, this is not the post-procedural. It's not mentioned about any post-procedural complications. genitourinary system. No. Anyway, let's look into the other code. Z43.6. What is Z43.6 represents? Z43.6 represents encounter for attention to other artificial openings of urinary tract. Encounter for attention to nephrostomy. Encounter for attention to ureterostomy. Encounter for attention to ureterostomy. So here the patient is in the OP for what? Or the patient is in the hospital for what procedure? She is here for regularly scheduled stent change. She is here for a regular checkup, right? So regular checkup means it will be Z code, the same which we have taken now, Z43.6, encounter for attention to, here the procedure is left ureter, so ureterostomy. See, stent change, patient is here for a regularly scheduled stent change, ureterostomy, stent change. Okay, so our ICD code will be Z43.6. And then what will be the CPT code? Just take 50688. 50688 represents change of ureterostomy tube or externally accessible ureteral stent via ileal conduit. Yes, that is mentioned in the first sentence. 45-year-old female stricture on the left ureter with the ileal conduit at the ureteroileal anastomosis. She had chronic stricture and received scheduled stent changes. She came for the scheduled stent change and she is here for a regularly scheduled stent change. So she came for the stent change, right? So our CPT code will be 50688. Change of ureterostomy tube for the stent change. So we got the CPT code as 50688 and the ICD code as Z43.6. So which makes the answer as option C. So just ignore all other options. Okay. So these two will be the codes. So the answer will be option C, 50688 and Z43.6. So friends, these are few more questions from the previous year's CPC examinations. So if you found this video useful, please like and share. And if you're new to the channel, please support me by subscribing to the channel. You can press the bell button. You will be receiving all the notifications when the new video is getting uploaded. Okay. So stay tuned for more videos. Thank you so much. Bye. Take care.